Hi, how are you? How is everybody today? I'm from the what? What would you say? I'm from the Empowering New Nurses show. I'm excited today. How about you? It's one more day to go for the end of Black History Month. But as you know, we'll continue to shine on the other months, during the other months. Think also of the legacy of our pioneers and ensure that we shine as a people for everyone. So today on my show, we're talking, welcome. Today we're going to talk a little on uh, the nursing process. Somebody asked me, what that is that? What it entails. So for those who don't know, there's a systematic way of how we approach the care that we give our patients to ensure that the patient receive the best care. So, regardless of the specialty, it's a scientific system in place whereby if we follow them step by step, our outcome should be, we should have some results. And then we can reevaluate if it's not working. So what it is actually, it is a systematic development and evaluating process for the plan of our patients. And that helps our nurses to provide patient-focused care. First of all, someone asked a question. So, what phase are we? Are there different phases? Yes, indeed. So, think of first the assessment. When we see our patients, how we gather information from them, data, as we would say, about their physiological, their psychological, their social, and their lifestyle, the factors. So we have gathered all this data, this information. Here we are now diagnosing. We are not the doctors. However, the symptoms, the symptoms that are causing this problem, we're going to zero in on them, symptoms and behavior. As we go in, so we are at the assessment, then we are at the diagnosis, then we are planning now. We plan, we plan because we're going to set some goals because we have the problem, how we're going to help with these problems, how we're going to help to resolve. So we set some goals. The time frame, yes, we do. All right. So after we've set our goals, what we have planned, we're going to put them into practice. That's the implementation phase. So we carry out the plan of care to achieve our goals. Okay. Now, after we have put our plan into place, they have been implemented, we are going to what? We're going to evaluate. We're going to see what works, what is working, what's not working, and we make adjustment to improve the outcome. So we should be at all time remember that it doesn't matter what specialty you are in. It is a scientific method that helps nurses provide the best care for the patient. So important. So as you see the nurse has different things that she encounters. There are different things that she has to put in place. When she sees a patient, that process comes to mind as she makes her assessment in the mornings or whatever shift she's on. Those things are part of the basic uh, areas that are covered so that individualized care can patient can experience that. Just remember, one care plan doesn't fit all. The diagnosis, that patient's individuality, that's what matters. And you're going to make that plan for that. You're going to set the goals, depends on the diagnosis for that patient. And they vary according to the different patients. So thanks for listening. And this is just a little reminder. Okay. Yeah, we're looking at the outcome and we have to readjust. We have to readjust. We have to make different changes accordingly as we evaluate. And that just brought me back to taxonomy, Bloom's taxonomy, what we're looking for. in our questions. What are we looking for? Very important. Evaluation usually be the last. Yes, because we're evaluating, we want to see what worked, what didn't work, what can we do to make things different and change. I'm excited. When I review some of these things that I studied long ago, my young nurse just remember that. That's an essential part. It's a scientific, evidence-based. We can ensure that our patient can receive the best care when we make a plan of care, it's a process. So again, we go through the assessment phase. Then after the assessment phase, we're going to diagnose. After we diagnose, we're going to plan. And as we plan and set our goals, we're going to implement. And upon implementation, we're going to evaluate. Where nurses assess to see how the plan work or what needs to be done differently. So thanks so much for listening. You can connect with me for more tidbits, for more pearls as you go on your nursing journey in a fun way. Make it fun. So I'm Miriam Amanda Smith on YouTube. I'm also Podcast Mayor on Instagram. And of course, on podcast is Empowering New Nurses. I would like you to subscribe, share it with someone else that they too can be empowered. Be blessed.